welcome to all of you who are coming in from every part of the world where you are, many North America, Europe, South America. I see lots of different people, and it's so great to see the vast interest in the topic area that we're working on today. So today we're looking at dental and thyroid health, and as a practitioner, how thermography can support you in pursuing your health practice with your patients. So I want to first of all say that at the end of this webinar, for the last few minutes, we will have a Q&A session. So please take notes and hold your questions till the end. And without further ado, I'd like to introduce Alexander Mostovoy, who is going to be speaking today. He is a distinguished clinician, author, and researcher. He's acknowledged for his unparalleled contributions to breast health, cancer prevention, and clinical thermography. He has over 20 years of experience in homeopathic medicine, and he's been exclusively focusing on medical thermography since 2016. He has successfully shared his expertise, providing lectures across Canada, the United States, South America, and Europe, training numerous professionals on breast cancer prevention and thermographic techniques. Among his many accomplishments, Dr. Mostovoy is the best-selling author of Breast Cancer is a Preventable Disease and was instrumental in orchestrating the 2016 Breast Cancer Prevention Global Virtual Conference, which garnered attention from over 5,000 international participants. Professionally, he has pioneered and directed an integrative health clinic in Toronto, where he introduced the innovative breast thermography method. And as a visionary founder and CEO of Thermography Clinic, he expanded the venture to over 30 global locations, serving more than 60,000 women. Dr. Mostovoy, a Homeopathic College of Canada alumnus with a doctorate in homeopathic medicine and science, is among the few board-certified clinical thermographers in North America. His affiliations include his current presidency at the Canadian Association of Clinical Thermography, as well as holding esteemed positions in various thermographic associations. His voice is echoed through multiple television and radio appearances, and his insights have published in numerous health periodicals, showcasing his dedication to the field and the well-being of patients worldwide. So once again, welcome, Alexander Mostovoy. Thank you for shedding light today on this topic, and we can't wait to see what you have to share.
Thank you, Tally. I'm glad to be here with you, and thank you once again for joining us. We would like to do this on a monthly basis, as we have committed to do that. So today, excuse me, I'm a little hoarse today. Today, we're going to be talking about thermography in thyroid and dental care. Why thyroid and dental care? I gotta start maybe with a little story. Years ago, I think it was 2006, I was giving a lecture at A4M in Orlando, Florida. And a doctor came up to me at the end of the lecture asking, do I see a connection between dental pathology and breast cancer? And I said, no. She says, how come you, what's going on? I said, no one ever told me to look there. We have become very good friends with Dr. Simon Yu, who is kind of famous in his own kind of way. And ever since then, I decided to kind of start looking at that. And lo and behold, there's a lot of things that I've noticed over the past 15 years, or maybe actually longer than that now. So without further ado, let's start this particular webinar. And like all kind of introductions, I'd like to start with a very, very bold statement. And the statement is going to say that silent oral infections cause most heart attacks and breast cancers. Now, why would I say something like this? Well, you'll have to stay for about an hour to find out why I'm making a bold statement like this. So first, I want to quote another good friend of mine, Dr. Levy, who is a cardiologist himself, has written, actually now it's 12 or 13 books. He publishes a book at least once a year. And this one is one of my favorites, actually. It's called Hidden Epidemic: Silent Oral Infections Cause Most Heart Attacks and Breast Cancers. And if you have the book, if you don't have the book, please get it. You'll see that there's a lot of research that has been done in this particular area, where there's a huge connection between hidden, so-called hidden dental infections, and not just breast cancers, but also cardiovascular disease as well. People assume that most dangerous and toxic infections in the teeth would be the ones that are most painful, but that's not always the case. Actually, in fact, studies reveal that cause and effect relationship between heart attacks and pathogens from silent chronic infections in the teeth. So here's maybe a little bit of a disturbing picture of periodontal pathogens, and at the same time we're looking at inside vasculature. You're looking at the same pathogens that are being kind of not necessarily directly from your mouth too, but there's definitely a connection there. Chronic apical periodontitis, or CAP, is a group of inflammatory diseases caused by microorganisms, mainly bacteria, infecting the necrotic root canal system. In apical periodontitis, it's a complex multifactorial condition originating from infected necrotic pulp or a failed endodontal treatment. So it actually develops asymptomatically. And I'll show you a study that I have been involved with myself a few years back that shows that in the majority of cases, people are, or patients are actually asymptomatic. Here's another, in a study of 103 patients undergoing coronary angiography, 65% had coronary artery disease and 42% had that CAP. Patients with CAP had 2.8 times higher risk of coronary artery disease. The primary source of oral infection toxicity, number one, is root canal treated teeth, okay? There are others, of course. You're looking at infected teeth, you're looking at chronic periodontal or gum infections, cavitational gangrene, chronically infected tonsils, infected dental implants, as well as toxic metals. Now, you're looking also at infected teeth and breast cancer. So pathogens, including the significant periodontal pathogen, also has been found in women with malignant disease. The same pathogen already has been strongly linked to cancer elsewhere. Okay, so in many women, chronically infected teeth cause much of the breast tissue to be continuously suffused by lymph-containing oral pathogens and their related toxins. Here is something from actually Breast Cancer Foundation, where they have done their studies and they have published this particular picture that gum disease connection. Women who had gum disease or missing teeth were 11 times more likely to be diagnosed with breast cancer. And lo and behold, 75% of American adults suffer from various forms of gum disease. So you can see that there is definitely not only connection, but there's a huge predisposition, if you wish. This study was published years ago in Romania, where they discovered that in 20 breast cancers, compared to 8 benign breast lesions, nickel, chromium, zinc, iron, mercury, and cadmium were actually intensively used in dental restorations. The same metals were actually found in breast cancer lesions as well. Many of you have seen this chart. I'm going to show this one more time. This is called the meridian tooth chart, where there is a connection, at least in the acupuncture meridian kind of system. There is a connection between teeth and different organs. So I just want you to kind of follow my cursor, if you wish. If you're looking at right upper second molar, right upper first molar, as well as bicuspid, you're looking at right breast as well. Of course, there's thyroid, there's thymus, there's other organs as well, but you can see the connection specifically here. Now, this is an interesting chart. Not everyone kind of understands this, but a lot of dentists and a lot of holistic health practitioners understand the connection here as well. Let me just give you a quick introduction. Those who are not familiar with thermal imaging, what you're looking at is heat that comes to the surface of one's skin, and then is being captured by infrared cameras. On the side here, you will see a color scale, and by the color scale, you'll see different numbers. These numbers are degrees in Celsius. In this particular case, we're looking at the upper window and the lower window of 36 to 26 degrees Celsius. So darker colors will be cooler temperatures and lighter colors are warmer temperatures. In this particular case, you can see that there is some very kind of unilateral presentation on the right side of the face and the neck. In this particular case, you're looking at, excuse me, 34, 35 degrees Celsius. Anything over 36 degrees is going to wash out to white. Okay, so that's very, very kind of abnormal and unilateral presentation compared to the opposite side. In thermography, there's kind of a very simple understanding that since we have two breasts, since we have two legs, two arms, two parts of our face, anything that's unilaterally kind of abnormal in terms of temperature variation, definitely something is going on. Here you're looking at the next image, you're looking at the neck, and finally you're looking at the close-up of the face, anterior oral view. Now, let me show you a bit of a case study. In this particular case, we're looking at right maxillary quadrant, shows early loss of first molar tooth, okay? Right side is here, left side is here. And left maxillary quadrant indicates likely early loss of first molar tooth as well. You can see that there is a relationship between these images and this panoramic X-ray that was taken as well. Here's another image that I would like to show you. There's heat in and around this area. The upper right first premolar happens to be necrotic. It's an X-ray. And lower right happens to be with the bridge, also happens to have necrotic tooth here. There's a connection between TMJ and breast cancer. In this particular case, we measure 2 points um, just kind of outside of the ear canal, the upper and lower jaw. The TMJ points are measured. In this particular case, we're looking at delta T, the difference between 2 points of reference of 1.4 degrees Celsius, which is quite significant. With dental examination, it was confirmed. Unfortunately, in this particular case, we also have kind of a very high risk thermal image of the breast. And in this particular case, unfortunately, this patient has been confirmed as well. I have seen a disproportionate amount of women with TMJ that are also high risk for breast cancer as well. Obviously, this is quite an obvious example, but it's not unusual to see breast cancer as well as dental pathology, as you will see a little later. So if any one of you who is imaging already, I would love to kind of impose one very important thing, that if you're imaging the breast, you have to image their what we would call orofacial imaging as well. This is from an old patient that came to us years ago. And as I was looking at her right breast, you can see in this particular case, it's this area here. I wasn't sure whether or not to be aggressively kind of escalating. But when I looked at her facial image as well, something told me that, yeah, we need definitely to be a little bit more aggressive than usual. This, you probably won't see it on your screen, but this was a letter from her physician that she was actually late stage breast cancer. So here we have an image of a woman who has lost her breast with mastectomy. And again, you're looking at the same side, most likely kind of heat. Not naturally, with thermography, we can't really go in and do a proper physical exam. So you can see that we have sent this particular patient to an oral surgeon. And this was the letter written back to us by the oral surgeon with all his findings. And again, I'll just say it one more time. I don't think that breast cancer caused dental pathology. I think most likely it's the other way around. I'm not suggesting that that's the primary cause. I'm just suggesting that there is a predisposition in this particular case to, in this case, maybe it's breast cancer. In someone else's case, it may be cardiovascular disease or many other kind of pathologies. Here's another study of lower left necrotic, this area here, necrotic molar, which was confirmed with dental X-ray as well. So as I mentioned to you that I've been involved in a study years ago that was published in the European Journal of Ophthalmology in 2012. And my interest was basically looking at, can thermography be used in conjunction with other methods of dental or oral evaluation? So we've set up a study with the local dentist, and this is, of course, we could use other methods. We could just, which are maybe very, very crude, just to kind of put a smile on your face. No, that wasn't the method used in our study. But generally, what we're looking at is patients' complaints and symptoms, right? When do you go to your dentist? Usually when you are in some kind of discomfort. So they will do a dental examination. They might also provide you with an X-ray. And that's about it. Are we missing something? Do we have other methods? So what we have done, as I said, we've devised the study with a local dentist, and without going kind of into great details, what we found, I'm just gonna come to the chase here. We had 2 examinations within 1 year. We had 20 subjects altogether. There was a 90% confirmation rate within that first as well as second dental evaluation in 1 year. So there's definitely a very strong relationship between infrared imaging and the findings on the dental exam as well. Now, what really astounded me was the fact that 70% of patients had no symptoms. And that's something that, you know, if there's nothing else that you want to take away from this presentation, I want you to understand that in 70% of evaluations, they had absolutely no symptoms. And yet there was sign of dental pathology based on our initial evaluation and dental examination. And that, by the way, if you remember just a couple of slides ago, that's what Dr. Levy also suggested, that in a lot of periodontal issues, when it comes to CAP, many patients are asymptomatic. I'm going to present a quick little study of a male who was 38 years old at the time. This is a few years back. He had chronic sinusitis, allergies, headaches. Vision problems were to the point where he couldn't drive late at night because the brake lights from the car in front of him would immediately give him a headache. He was fatigued, sleep problems, and every time I would see him, he basically had to go through a whole kind of box of tissue paper. So I asked him, how was his treatment? And his treatment basically consisted for the past 10 years of antibiotics, Claritin, and Imovane. So you can imagine, with so many kind of courses of antibiotics, what his biome, what kind of hit his intestinal kind of system took just to treat this particular issue. And he wasn't really getting any better. So I asked him how was his dental health. He kind of looked at me like I'm from another planet. Later on, months later, he called me up and said, you know, I'm not really getting anywhere with my treatment. You were the only one who asked me about that. And I wonder, why did you ask me this? I said, well, I find sometimes there's definitely a connection between dental issues and sinusitis. And I was just wondering if anyone kind of took a look at that connection. Do you have any dental issues? So I invited him to our office. We took the images, and this is what we found. As you can see, this was in March of 2016. Both of his kind of sinus issues here, sinus issues there, a lot of kind of high risk dental, possibly dental or periodontal issues on this side as well. So what happened, I asked him to go kind of get examined. He did. And what happened was that he had a root canal in those areas. And the dentist who performed the root canal told him that there's absolutely nothing wrong with the root canal. There's absolutely no connection to his suffering from it. I wasn't really satisfied with that, so we sent him to an oral surgeon. The oral surgeon said, yes, there's definitely a problem with the root canal, and I'm going to fix it for you. He called me, and I said, please don't do this, just pull the tooth. He didn't listen to me. He decided to save his root canal or root canal tooth, which of course is necrotic and problematic to begin with. But he decided to go with the treatment that was offered. And unfortunately, 2 weeks right after redoing that root canal, he had a huge blow up with infection, and eventually he had to pull the tooth. Here's what happened. This was the original kind of panoramic view, and here we have the extraction, and here is before and after. So you can see that especially the right side of his face compared to this one, greatly improved. The left side still has a problem. Sorry, I'm just going back. Still has an issue, but we didn't take care of this at that point in time. I just wanted to show before and after the extraction. Other than the extraction, we supported him with some botanicals, some homeopathics, and here is what happened: that in a very short period of time, his sinusitis greatly improved, his sleep improved as well. He can drive late at night without kind of getting headaches. As a matter of fact, all of his headaches are gone, vision normal, fatigue gone. And this is just because he had an extraction, okay? There was more to this particular story, but I don't want to bore you with all the silly details that came out of his dentist. We're also looking at hypothalamus. Sorry, at thyroid. Of course, I don't know. Just remembered my anatomy professor who was kind of drilling us about hypothalamus. So that was probably why I started with hypothalamus. But thyroid is also very important. In my opinion, when it comes to breast disease, breast cancer, thyroid, in many cases precedes breast conditions. So the usual presentation, I mean, this is maybe extreme, but the usual presentation, you will see something like a ring around the color. You will see also very kind of cold body temperature. In many cases, these people will go get their TSH levels done, and as long as they are within the so-called normal range, and normal range is really very subjective, who is normal and who is not, their symptoms are going to be ignored. However, if you look at, again, at the body temperature, there is going to be 2, maybe sometimes even 3 degrees lower than average. Well, you know, you may suspect Wilson's syndrome. You may kind of redo the blood test, maybe with additional testing. You may kind of look at other things, but the typical presentation is kind of cool or coolish thyroid area. You know, we don't see ring around the color every day, but we see enough of them to kind of say that definitely something is going on. In this particular case, this patient also may have some sinus irritation, but we're just going to stick to facial and dental imaging. What I find is very interesting that in many cases I will pick up things that look like, I don't want to say that we pick up thyroid nodules, but things that make me think that most likely this is a hot nodule. Not as frequently we will see cold nodules, but maybe 95% are hot nodules, which are benign. And in order to kind of test our suspicion, we will send this patient for a thyroid ultrasound. Most likely it will be confirmed. So I can't say just by looking at someone's surface of their skin, aha, this is a nodule, but most likely This is what we're suspecting based on the presentation that we're looking at. And by the way, just to kind of to stay on the subject, what I want to kind of emphasize that in the majority of cases, thyroid ultrasound is not something that's part of general physical examination. You may kind of examine your patient just kind of physically with your hands. Sometimes you may pick this up, sometimes you may not. Thermography allows you to pick up certain things that otherwise may be missed. I've always suggested that thermography or infrared imaging is just an extension of your patient's physical examination. So in this particular case, again, thyroid nodules are not necessarily giving this patient symptoms. They may not be even aware that they have them. And yet, in this particular case, we will kind of pick this up, escalate to an ultrasound will come and confirm. At least as a practitioner, you can deal with something like this. Otherwise, probably you wouldn't have known what's going on. As I said, breast cancer and thyroid, in many cases, thyroid conditions will precede breast cancer. You can see, this is the facial, you can see very kind of cool jaw, or lower jaw is the same patient, but here we have massive late stage breast cancer. Now look at the very cool thyroid area as well. So again, the connection is there. There are other applications using thermography when we're doing kind of orofacial imaging. In this particular case, you're looking at the same trigger points as you see on this particular diagram. So some people may have headaches. In some cases, these headaches could be easily kind of identified because we can also see the trigger points with thermal imaging as well. So any kind of myofascial symptoms could be thermography will give you kind of an additional information as well. Carotid occlusal disease, not common, but from time to time, as you can see, we will see an occlusion or potentially an occlusion. And again, with Doppler ultrasound, we can confirm. In many cases, as many practitioners will attest, that carotid artery disease may develop slowly and sometimes unnoticed, but it's a huge risk. It could lead to not just mini stroke, to any huge strokes as well. And, using thermography to identify abnormalities when we're looking at this particular image definitely could save someone's life. And again, it's completely non-invasive. So thyroid dental sinus, well, we have a thyroid called thyroid. We probably have a dental pathology. And in this particular case, the patient may be even complaining about sinus issues. And again, just like I've presented with another case where dental pathology was aggravating the sinus issue as well. Here you will see that there is lymphatic drainage congestion present in this particular case as well. So very important to kind of look at things holistically, because again, you may not even see, well, otherwise you can't see what's going on. I mean, so I decided to kind of throw a little bit of research. So I'm not going to bother you with all of the research that's out there, but if you go to your Google search and type in thermography and thyroid, you will find 7,550 results of different studies. Some are recently published in 2021, 2022. Some are a little older, but you'll have pages and pages and pages of information of how thermography or thermal imaging is used in conjunction to just thyroid alone, never mind other types of thermal imaging. What are the advantages? The advantages that I see all the time. First of all, again, it's a non-invasive method. Very important. Secondly, it detects abnormal temperature variations, whether it's thyroid, whether it's dental, whether it's sinus, whether it's carotid issues. Again, temperature will give us a clue as to what's going on. Useful in chronic conditions, right? Venous diseases, as I mentioned, thyroid, and it helps in monitoring recurrent disease. It will also help you in monitoring treatment. It will detect inflammation naturally. It will definitely aid in diagnosis. As I mentioned, thyroid nodules are very, very common. Unless you use thermography, you would have to use routinely thyroid ultrasound. Hardly anyone does that. And it's adjunctive diagnostic tool. So thermography kind of points you in directions where otherwise most likely you wouldn't be able to get there. It's quick, it's efficient, it's safe, it's radiation free, and finally, it's very cost effective. Again, the references are here. If anyone is interested in kind of understanding the connection between root canal and not just breast cancer, but root canals, as I mentioned, and cardiovascular disease, these are two of my favorite books. There's definitely more literature out there. The one that's called Rescued by My Dentist is written by a former friend and a teacher. He's been practicing dentistry, I think, for over 50 years. I've really learned a lot from Dr. Cook myself. He always kind of suggested that, you see, high-speed drilling, what happens with high-speed drilling is that high speed generates a lot of heat. That heat actually damages the tooth. Okay, so he always used to actually drill slow speed. I know that for a fact because I was sitting in his dental chair, and I've had personal experiences with slow speed instead of high speed. But at some point in time, dentists kind of came to this as well. They started using cold water as they're drilling. However, you may not feel it, but the tooth is being damaged with high-speed drilling. Also, no metals are compatible because any kind of metal basically is going to kind of interfere with electrical conductivity, and that's a big no-no. So today, when maybe we're taking out root canals, but we're putting in other complicated tissues like implants. We used to have the majority of those lately have been titanium implants, which is still a metal. Lately, there's a new trend coming from Europe, and more dentists locally are starting to use zirconium. It's not a metal, it's quartz, but we really don't have enough evidence to say whether or not they're safe. In my personal opinion, I would suggest that if you have root canals, please don't replace them with implants. Partials will do, may not be as aesthetically pleasing, although you can't really tell the difference. But you know, in my opinion, it's a much healthier way to go. Another one study that was done by Dr. Jones, it was a 5-year study of 300 breast cancer cases. 93% of women had root canals. 7% had other oral pathology. So as you can see, there's a lot of literature out there. Unfortunately, the majority of dentists, for different reasons, seem to ignore this. Unfortunately, and I spoke to Dr. Levy myself, he's also very frustrated as a cardiologist, that the majority of cardiologists are ignoring the research that there is a dental connection to, or periodontal as well, connection to cardiovascular disease. So, well, what can I say? I guess that's one of the reasons why we have this webinar, so to kind of to educate and to make sure that people understand there is a huge connection between your oral health and your general health. And for those who are not practitioners listening to this, let me ask you one simple question. When was the last time your family doctor asked you about your dental health? Most likely the answer is never. It doesn't mean that it's not important. And so here we are, our kind of plan here and our idea is to educate not just practitioners, but patients and lay people as well. I think it's very important that you understand you have to do your own research, and definitely you have to become your own health advocate. So in summary, remember that this is the webinar series, and next month we'll have another one, is presented to you by Canadian Association of Clinical Thermography. Our key is to establish thermography as an imaging tool in healthcare. So we definitely want to advance this understanding, this knowledge, and this tool to enhance the patient care and quality. We strongly believe that thermal imaging is a transformative potential in healthcare, and we would like you to join us. We would like you to support us. We would like you to get additional information from our website. If you have any questions, by all means, get in touch with us. Here's the email, the phone number, and I think we have a few minutes left. So if anyone has any additional questions, I'd be happy to address those.
Well, thank you so much. We do have some questions, so thank you for everything so far that you've said. I do want to put one additional piece of information about the Canadian Association of Clinical Thermography. It is a not-for-profit organization, and everything that we do is really for the purpose of what the mission is, really to expand the knowledge and awareness of thermography for more and more people in general, and for practitioners and government and insurance companies, etc. So if you go to our website, you'll see there is a place to make a donation and become a supporter, and any amount is always welcomed. We try to put on as much free content information like these webinar series as we can. We've done 2 major full day free conferences online as well. So we don't expect you to pay for these, but I'm just saying that every contribution is definitely welcomed and appreciated. So we do have some questions. The one question is about thyroid. So there was a question about why worry about a hot, benign thyroid nodule.
I don't think, well, as my late aunt used to say, worry is the most unproductive emotion. It's not a matter of worry. If you have nodules, thyroid nodules, even though they're benign, it's indicative of some form of a dysfunction. It could be metabolic dysfunction. It could be lack of iodine. It could be something that becomes later on symptomatic. So, they may be common, but this is not a normal occurrence. So it's indicative that some imbalance has already set in, to the point where your thyroid is trying to kind of grow a little bit larger with that nodule. And, it's easily addressed, and it should be addressed.
Okay, great. Thank you. Then there's a question about, there was a poster near the beginning that said women with gum disease or missing teeth have 11 times the risk of breast cancer.
Yeah.
Also asked about missing teeth connected to breast issues, and asked about how to replace the tooth, but you did address that. So
Yes.
maybe you can just talk about, how does missing teeth pose a risk?
Well, in itself, it doesn't. It's just that there is a higher probability that there may be periodontal issues. And that goes back to connecting to periodontal disease. So you may have a little bit of a gap in between a missing tooth and the tooth next to it. There could be some pieces of food or bacteria that enters that little pocket. So again, just because someone's missing a tooth, that's not necessarily an issue. It's what occurs because of that. I'm more kind of interested in periodontal disease. How do you to kind of address that? As I mentioned, the partial would be my choice. Again, most dentists are going to usually push for an implant, and I see a lot of issues with implants. First of all, even if you were to do this, please make sure that the material is compatible to you, and you can get tested with, let's say, electrodermal testing or any other types of testing, muscle testing, whatever works for you, that the materials that are going to be inserted all the way into your bone are compatible. The second thing is, sometimes your bone is not going to accept that implant. And that's another kind of problem, that maybe 6 months later, you still have inflammation there. The fact that you've lost a tooth, most likely it has been infected. That's how it started. Then it went into kind of root canal procedure. The surrounding tissue, the gum tissue, is also most likely going to be somewhat infected, or at least susceptible to infection. So the whole thing needs to be properly done, scraped all around that tooth, all the way up to the jaw bone. Not pleasant, but necessary, because you will have kind of residue of bacteria and infection quite deep. At least, as I said, I'm not a dentist, but I've learned all this stuff from Dr. Douglas Cook, who performed these things on me. So I can't say that, this is theoretical. It's definitely something that I've experienced myself. Anyway, okay, next question.
Great. Yep, that's great. So so someone here made a comment here that she went to her dentist with inflammation, as was showing on her thermography report, and she was diagnosed with sleep apnea, which can be fixed with a dental guard. So thank you so much for that. So someone asked, will this be recorded? Yes, it's being recorded. And then there's a question, do you work with a holistic dentist? So we don't work with a particular holistic dentist. we do have a list of a few people who are holistic, you know, Dr. Mosswood can speak more to this, but there's a bit of a range. Someone can call themselves holistic, but what does that really mean? But you know, there are definitely some holistic dentists out there. The one that we were working most closely with, unfortunately, has, you know, passed away. And but we do have some other recommendations.
Yeah, there's
Anything else to add to that?
yeah, there's American Association of Dental dental or oral something in toxicology. If you want, email to us, and the name will come back to me. These are registered members that years ago this association started because they were against putting mercury into people's mouth. I've lectured there a couple of times. They're nice people. Not everyone is so-called holistic, at least based on my standards, holistic or bioidentical. But at least most of them will not be putting mercury into people's mouth. Strangely enough, you know, mercury is toxic everywhere else unless it's in your mouth. So, but yeah, so there's one. Then there are a couple of kind of so-called holistic dentists associations. You know, for some reason I'm blanking right now with the full kind of name of this association, but they do have members in the United States and Canada, worldwide. So if you'd like to, if that's what you need, please email to us, and then I'll make sure that you get links to these people. And then one more thing is you have to kind of interview them, and you have to approach them from kind of your requirement. In other words, what I'm trying to say is, if I were looking for a holistic dentist, I would pick up the phone and call them and ask, do you do root canals? And if the answer is yes, based on my criteria, that's not good enough for me. But that may be good enough for you. So again, you have to kind of make your own judgment.
Someone here also added, look for SMART certified, all caps, SMART. So it's not an acronym that I've been aware of, but maybe you know what that is. SMART certified.
No, it doesn't ring a bell right now. Maybe they can tell us what it is.
Thank you for that contribution. Okay. All right. Well, again, thank you so much, everybody. Thank you, Alexander Mostovoy. Thank you so much for your wisdom and shedding light on this topic for many of the people that have joined today. And thank you for joining. You will get a recording. And thank you so much. And we look forward to seeing you next month. The day is going to be December 13th, Wednesday, December 13th, again, 12 to 1 o'clock Eastern time. Look out for your email about that.
And what's the subject?
Subject is osteopathy and thermography.
I think you're breaking up. I think we're going to be talking about pain.
Oh, I think connection is a little bit weak.
Anyway, get ready to talk about pain and thermography. So I hope and I wish nobody has pain, nobody will be in pain. And again, thank you very much for joining us, and hope to see you all next month. All the best.
The Canadian Association of Clinical Thermography is dedicated to making thermography more accessible and available to those who seek it. Become a supporting member today and help us transform the way medical thermography is understood in our world by practitioners and the general public. Visit us today and join us.